This conference will now be recorded.
Hi, everyone. Thanks for joining us today. We're the sales team for Springer Nature for the Americas, and we are here to present you our Q1 2021 medical list.
Okay, so for the first title to kick off our list, it's Blockmate. Regional anesthesia can be a safe alternative to general anesthesia. However, there is a lack of formal clinical training in regional anesthesia in most of the anesthesia postgraduate curriculum, and this book intends to bridge that gap. Blockmate covers all commonly practiced nerve blocks in detail with pictorial guides. This is a highly informative and carefully presented book for trainees and postgraduate students of anesthesiology as well as practicing clinicians. For our next title, we have Pediatric Sedation Outside of the Operating Room. Edited by Dr. Kira P. Mason of Harvard Medical School, she is a leader in pediatric anesthesiology. Pediatric sedation outside of the operating room will continue on the success of its previous editions. It is an essential guide to the safe and effective sedation of pediatric patients outside of the operating room. It maintains its status as a premier acclaimed book on pediatric sedation, featuring updated chapters and new chapters with timely and relevant topics. And the last title I will present right now is Nutrition and Infectious Diseases. This comprehensive and user-friendly volume focuses on the intersection between the fields of nutrition and infectious disease. It highlights the importance of nutritional status in infectious disease outcomes and the need to recognize the role that nutrition plays in altering the risk of exposure and susceptibility to infection, the severity of the disease, and the effectiveness of treatment. This book includes a chapter on COVID-19, so it's quite timely for the global pandemic. Nutrition and Infectious Diseases will be a go-to resource and guide for immunologists, clinical pathologists, sociologists, epidemiologists, nutritionists, and all healthcare professionals managing and treating patients with infectious diseases.
Okay, over a decade has passed since the original edition of the Clinician's Guide to Dermatologic Differential Diagnosis published. This first edition sold several printings, and it is a definitive resource within the dermatology community. In the second edition, the massive 2-volume work features over 4,000 new photographs of rare symptoms, 98 new chapters, and presents a complete update on all references and new findings since the original publication. The authors also have a unique platform set up that includes a website and an app to work as companion tools alongside the text. Conditions affecting the American medical profession have been dramatically altered by the continuing crisis of cost increases, quality concerns, and lack of access facing our population, along with the ongoing corporatization towards bottom line. The corporatization of American healthcare examines the overall context and dynamics of modern medicine, focusing on the changing conditions of medical practice through the lens of corporatization of medicine, physician unionization, physician strikes, and current health policy directions. It is a necessary resource for health policy analysts, healthcare administrators, health law attorneys, and others associated with the health profession. This edition of Personalized Specialty Care, published in partnership with the Dutch Federation of University Medical Centers, represents 8 university hospitals in the Netherlands. It presents state-of-the-art examples of personalized care, best practices for shared decision-making, and offers inspirational ideas to help hospital directors implement value-based healthcare applications.
The textbook of patient safety and clinical risk management examines the culture of safety in the care environment and the human factors influencing it. Human factors assume decisive importance in resilient organizations, and an understanding that risk control and containment is fundamental for all medical and surgical specialties and deeply rooted in medical education and early years in practice. This book is intended for residents and young professionals in different clinical specialties and offers recommendations and examples of how to improve patient safety. A chapter about COVID-19 treatment is also included. Sex and gender-based women's health provides primary care clinicians, researchers, and educators with a guide that helps facilitate comprehensive, evidence-based healthcare of women and gender-diverse populations. Many primary care training programs in the United States breeze over formalized training specific to women's health. This book directly addresses this learning gap with a solid framework that can serve as a quick in-clinic reference or be used to steer curricular efforts. This is a guide for all providers, regardless of training, discipline, or seniority, through comprehensive outpatient women's health. The first edition of Management and Bleeding Patients received over 40,000 downloads and more than 130 print copies were sold. With an author team working across specialties, this second edition provides a comprehensive and state-of-the-art overview of major issues specific to managing bleeding patients. Like the previous edition, the sections are structured to review key issues, among them bleeding associated with disease, bleeding from specific organs, bleeding associated with medication, and bleeding associated with procedures. In addition to thoroughly revised and updated chapters, there are new chapters on the basics of hemostasis, bleeding due to rare coagulation factor deficiencies, bleeding associated with connective tissue disorders, massive transfusion protocol, bleeding associated with ventricular assist devices, and evaluation of bleeding risk prior to invasive procedures. This volume also includes brief etiology and a practical reference guide regarding blood type components.
Nephrology Worldwide connects and offers a comprehensive reference on nephrology practices, in other words, the kidney, epidemiology, and policies. Each chapter is independent and discusses nephrology in each contributor's country. There are 53 chapters and more than 300 authors from all continents offering a unique perspective on nephrology practice. It provides a much-needed information source for nephrologists around the globe. It will be a valuable resource for healthcare professionals and other stakeholders interested in learning about the status quo of nephrology worldwide. The next title, the first edition of Radionuclide Imaging of Infections and Inflammations has over 20,000 downloads. This atlas presents pearls and pitfalls and useful take-home tips. The second edition of this book reflects the changes to the rapidly evolving field of radiology. It highlights the expanding role of hybrid imaging without neglecting new radio tracers proposed for the imaging of infections or inflammations. The book will be an invaluable tool for residents in nuclear medicine as well as for other specialists. And the next book, this book, Situation-Specific Theories, presents the background information on situation-specific theories in nursing and essential guidelines for PhD and DNP nurse students. The very first book on the situation-specific theories in the market. Situation-specific theories are defined as theories that focus on specific nursing phenomena that reflect clinical practice and that are limited to specific populations or to particular fields of the practice. This book is led by two nurse researchers with high profiles. Dr. May Lace is an internationally renowned nurse scientist and medical sociologist at UPenn. Over the course of 5 decades, her scholarly contributions have informed generations of nurses around the world and influenced their education, practice, and research programs.
Health Promotion in Healthcare is an open access textbook that is the first of its kind. It connects health promotion with salogenic theory of health. The authors focus on factors that support human health and well-being and expand the understanding of health promotion beyond disease prevention. This unique anthology represents a vital contribution to global health education, offering insights into health promotion as part of patient care for bachelor's or PhDs. This can be nurses, occupational therapists, physiotherapists, radiotherapists, social care workers, and so on, as well as healthcare professionals and researchers. Global Midwifery offers comprehensive information for midwives in one unique volume. It addresses the importance of the UN Sustainable Development Goals to set principles for this field. This is the very first in-depth book covering the specific topic of global midwifery on the market. Soft Tissue Tumors is a practice-oriented guide including comprehensive coverage of over 130 soft tissue tumors. Here, Epidemiology, presentation, diagnosis, genetic predisposition, pathology, biomarkers, prognosis, and therapy are presented in a schematic and easy to read format.
Sarcoma, a practical guide to multidisciplinary management, presents an evidence-based review of current practices in management of tumors and the future direction of treatment. This important resource compiles expert knowledge and advocates a multidisciplinary approach to treatment. Separate chapters and sections highlight the specialist diagnostic and therapeutic approaches employed in treating bone and soft tissue sarcoma. The book's editor works at a major center for sarcoma management in Australia. Aesthetic facial surgery is a comprehensive overview of facelift techniques that is a beneficial resource for plastic surgeons regardless of experience. It includes all the anatomy relevant to such procedures. The text is brought to life by figures, photographs, and videos. The Healthcare Efficiency Revolution, a unique and timely book, was created for departmental and institutional healthcare professionals. It provides effective and lasting solutions that reduce ER and physician consultation wait times, complications and hospital readmissions, and laboratory tests performed, as well as increase OR productivity, annual numbers of patients served, and overall rates of staff and patient satisfaction. The book also includes the COVID-19 pandemic and its impact on healthcare management in hospitals and other medical facilities.
Principles and Practice of College Health is a comprehensive title that offers state-of-the-art guidance on all the clinical principles and practices needed in providing optimal health and well-being for college students. It examines the medical considerations that inform pressing issues in higher education today. Developed by a renowned multidisciplinary authorship of leaders in college health theory and practice, and coinciding with the founding of the American College Health Association 100 years ago, Principles and Practices of College Health will be of great interest to college health and well-being professionals as well as college administrators. The next title we have is Medically Unexplained Symptoms. Despite the rapid advances in medical science, the majority of people who visit a doctor have medically unexplained symptoms, symptoms that remain a mystery despite extensive diagnostic studies. Psychosomatic symptoms are as real and as severe as the symptoms associated with structural damage to the brain. Medically Unexplained Symptoms debunks the common misconception that psychosomatic symptoms are all in our head. This book addresses the obstacles of managing people with medically unexplained symptoms in our modern day society from both a historical and contemporary perspective. It's written with a broad lay audience in mind that may be interested in difficult medical diagnosis. And for our radiology books, the second edition of Basic Radiology, Physics and Biology is a valuable reference for radiation oncologists, medical professionals in the field of radiology oncology, as well as residents and students. This is a fully updated handbook with 4 completely new chapters that reviews all key topics around radiation oncology. It also reviews medical dosimetry and radiation therapy for board exams. It presents concepts in a step-by-step format featuring mnemonics and cartoons to aid in comprehension.
Infections and Surgery offers an essential toolkit for all surgeons and intensivists interested in improving their clinical practices regarding the prevention and treatment of infections. The title is interdisciplinary and useful for classifying and treating surgical site infections, including essential knowledge and evidence-based advances in the field. A few years ago, I had ankle surgery, so I have a personal appreciation for this topic. Foot and ankle instability, a clinical guide to diagnosis and surgical management, is intended for wide readership, including orthopedic, pediatric, and trauma surgeons, emergency physicians, pediatric radiologists, and general practitioners. This book offers a comprehensive and in-depth overview of the unstable foot and ankle. It provides step-by-step surgical guidance supported by more than 500 high-quality intraoperative pictures. It presents foot and ankle anatomy and biomechanics as the basics for understanding the pathology and treatment concepts presented. Fracture Sonography, a comprehensive clinical guide, is of interest to a wide readership, including orthopedic, pediatric, and trauma surgeons, emergency physicians, pediatric radiologists, and general practitioners. This is the first book to comprehensively present sonography as a fracture diagnostic tool. It also provides practical guidance to implement fracture sonography in the clinical setting.
Foot and ankle surgery in children and adolescents is a valuable resource for residents, researchers, and physiotherapists wishing to gain insights into the surgical treatment of children and adolescents. This book draws on reliable evidence-based surgical protocols and a wealth of surgical experience, featuring case presentations and of various foot and ankle procedures. The number of natural and man-made disasters has risen dramatically over the last decade. Natural disasters, industrial accidents, and terrorist attacks represent major incidents, often involving multiple casualties. In such cases, health professionals face multiple challenges because the type of medical care required differs from what is taught and provided in their everyday hospital duties. Emergency medicine, trauma, and disaster management informs and prepares healthcare professionals for the challenges posed by major incidents so that they can act effectively in medical teams sent on humanitarian missions or into conflict zones. It offers a holistic and horizontal approach covering all stages of the disaster management cycle. Unique and pragmatic, Ultrasound Fundamentals is a back to basics manual on normal and pathologic sonoanatomy of head and neck, upper and lower extremity, chest, abdomen, and other major organ systems. There is a great breadth of material that is covered in a comprehensive manner, making it a great resource for board review and exam preparation for various medical, surgical, and allied specialties.
Urology titles focusing on technology and robots perform very well. Techniques of Robotic Urinary Tract Reconstruction provides a complete and thorough guide to the performance of robotic urinary tract reconstruction procedures, including the principles of successful reconstructive techniques in the kidney, bladder, prostate, and urethra. This book is a valuable guide for clinical practitioners in the utilization of advanced novel technology to aid in intra-operation and demonstrates the ways in which robotics enables the performance of reconstructive procedures in an area difficult to reach via open techniques. Next, we have our latest list of COVID-19 books. We like to share them with you as often as we can, especially during our presentations. The latest is 3D Printing in Medicine. It shows how 3D printing became vital during the pandemic and how it was utilized to produce healthcare supplies. A clinical synopsis of COVID-19 provides a comprehensive overview of clinical aspects of the coronavirus disease. Shared trauma, shared resilience during a pandemic very much resonates with all who are impacted by the COVID-19 pandemic, and it's an edited book that reflects the wisdom and ongoing efforts of social work professionals. The next in our series, in our list of COVID-19 books, is the applications of artificial intelligence in COVID-19. This one will release in April, and it discusses the use of AI-based tools in the diagnosis and treatment of COVID-19. And last but not least, we released in November the first social epidemiological study of COVID-19 that was in a primary US epicenter. So New York City is the focus of this title, but it will resonate for any major metropolitan city.
Thanks everyone so much for joining us for the presentation. We hope you find it useful, and do reach out to any of us or your rep for more information. Take care.